Hi, Dr. Raj here, and today's topic is going to be peritonitis in someone receiving peritoneal dialysis. This is a common question in the infectious disease and nephrology section of your board exams. Unfortunately, this is very common if you have peritonitis secondary to someone receiving PD. It has a high morbidity, high mortality. It needs to be identified quickly, and often it's a presumptive diagnosis. Of course, we always like to go for the gold standard, which is what? Getting a positive fluid culture, and based on the sensitivities, we can what? De-escalate. So when do we suspect it are going to be individuals here on peritoneal dialysis that complain of abdominal pain, that mention that the fluid is very cloudy. That's going to raise that clinical suspicion. And as a step back, why do we even use peritoneal dialysis? It is a form of treatment for those with end-stage renal disease, kidney failure, that actually uses the natural lining of the abdomen, which is the peritoneum, to do the filtering, to get rid of waste products, to get rid of excess fluid. So once we presume this is going to be the diagnosis, how do we treat? It's intraperitoneal antibiotics. That's right, intraperitoneal. We start off with two antibiotics. One is vancomycin to cover gram-positives. Of course, it covers Staph aureus and MRSA. And we use ceftazidime, which is a third-generation cephalosporin that covers Pseudomonas. And based on the culture and sensitivities, if we get it, we're definitely going to de-escalate. Do we use IV antibiotics sometimes in the treatment? Yes, if they're going to be bacteremic. But we love using, and the correct answer is give intraperitoneal antibiotics. And of course, the question always becomes, do we take out the PD catheter? And in most cases, we don't. We try to salvage the catheter. When do we consider taking it out in clinical medicine and on the boards? If they have refractory infections, lapsing infections, are they going to have a fungal peritonitis, which would be indications to taking it out? Is there an abscess? And if I haven't mentioned it already, when we're giving antibiotics, nephrologists and infectious disease loves giving prophylactic antifungal medications on top of that. This is a great question for your board exams and will help with the management of your patients. I will see you next time for some more pearls.